נעד, הרגע מילאתי. זה לא חם. בשנייה מילאתי את המים. We can see you.
You can see me,
Man?
yeah? Okay.
Yes, we can see you.
The share screen?
We can see you and we can see the PowerPoint.
Okay, okay, that's good. Okay, I continue. First of all, just update you on the percentage. Here should be 29.68. Earlier on, it was indicated as 19. So I've checked the document, it's 29.68 over here. All right.
Yeah.
Now we talk about the next set of points. I think all of us, Onetsu, those who practice Onetsu therapy are familiar with these points behind. These are known as the back shoe points. Okay, so the purpose of the back shoe point is to adjust the viscera, I mean the organs. Okay, activate the organs. What it says here is the pathogenic factors of tumor are very complex, but various internal and external factors eventually lead to organ dysfunction. Okay, so the causes of having the tumor eventually, okay, the causes could be internal, could be external, but eventually led to the organ dysfunction. Let's say, for example, liver cancer, it is the function of the liver. Stomach cancer is the problem with the function of the stomach, and so on and so forth. So chemotherapy belongs to a category of drug poison, according to traditional Chinese medicine. Okay, chemo is a drug poison. This poison enters the organ via the blood, leading to the structural damage and dysfunction of the viscera and the meridians. Therefore, result in the loss of appetite, causing the patient to become nausea, vomiting, abdominal distension, diarrhea, anemia, and other symptoms of the spleen and stomach. Okay, intestinal tract, kidney, liver as well. So this is what happened to the chemotherapy drug. It damages the functions of the internal organs. So therefore, we provide the treatment. Okay, the moxibustion provide the treatment on the back shoe points. Okay, the back shoe points are the points associated with all the 5 organs and 6 viscera. Okay, so their locations are adjacent to the viscera. In other words, if it is a kidney point, it is actually very close to the kidney location. If it is stomach point, it is close to the stomach. For example, bladder number 21, this is Wei Shu. Wei Shu means stomach point. So bladder 21, in this particular case, which is thoracic number 11. Okay, thorax number 11. So this is very close to the location of the stomach as well. Well, Senshu in this particular case here, BL23. Okay, and therefore, often when they do the moxibustion, they often use the back shoe point to regulate the internal organ, especially the disease one. Okay, so we look at the back, this back of the patient again. Okay, this is the governor vessel. This line here, 2 fingers from the spine, is the bladder meridian. Okay, on both sides, 2 fingers on both sides. So it's a pair of bladder meridian, and this is the most important because all the important organ point, the organ back shoe point, is lined up over here. For example, at this point here, which is thorax number 3. This is lung shoe. Okay, lung point. Next one, this is pericardium. The next one down here, coming down, this is heart. Okay, and going down, this is liver, this is gallbladder, this is spleen, this is stomach, and this is kidney, this is colon, and so on and so forth. The small intestine and bladder is the last one. So all the internal points are over here. So one of the points selected for this point is actually a BL17, which is called Geshu in Chinese. Okay, this is the meeting point of blood. Okay, which is between this point here, which is a heart point, and this point here, this is the liver point. Liver, according to Chinese medicine, is also responsible for the formation of blood. Okay, heart is important for blood, liver. So this point is also often used. That's why it is also a high frequency use point in the treatment we saw earlier on. Okay, so it is an important point for generating and nourishing blood. Okay, post myelosuppressive patient after chemotherapy. In other words, those patients who have undergone chemotherapy, they become very, very low in terms of the blood. Usually, if they seek traditional Chinese medicine practice, and this is one of the important points. Okay, so CV10 PC number 6, this is also important point, and of course HER2 number 5. These are mainly, as I mentioned, this one is on the stomach. Okay, this point here, the midpoint between the breast line and the belly button, that is actually the stomach location. We often use this to improve the stomach function. PC6, which is on your wrist over here, 3 fingers down from the transverse line over here, that is dealing with the pericardium. Okay, improve in terms of blood flow. And the last one, HER2, large intestine point, is often used to actually reduce pain on the upper side of the body. Now, then we look at the 64 studies. What were the moxibustion methods used? The first, again, moxibustion sticks, direct moxibustion, and indirect moxibustion, and of course, warming needle with moxibustion. They found that out of the 64 studies, 37 focus on this, 6 on direct moxibustion, 21 on indirect moxibustion, and the warming needles with moxibustion is 9. So obviously, the most popular one, moxibustion stick. Okay, and of course, this is the most convenient. And the methods used that was indicated in each of the studies. For the moxibustion sticks, the suggested, most of them actually use 2 to 3 cm away from the skin, and typically one session lasted 30 minutes. Okay, for the others 3 methods, there wasn't any indication. Okay, so let's look at some comparison studies now. In one of the earlier studies, okay, on the chemotherapy patients, they actually look at the different points. Okay, moxibustion ST36, SP6. And the second group, they actually started with injection of astragalus Again, this is good in terms of stimulating the qi. Okay, you want to, so this one is also available in the form of supplements. Okay, usually the TCM traditional practitioner make use of this to increase the qi of the patient. Okay, here they use injection, and of course I think this must be in the concentrated liquid form. They injected directly into the two acupoints, ST36 and SP6, and they compare it with this method of using chemotherapy. Okay, so both groups are 1, 2 are effective in raising the population of the white blood cells and immunoglobulin. In other words, the stimulation of the ST36 and SP6, okay, as well as the injection of this therapeutic material directly into these 2 points here. Both methods here are actually useful in terms of raising the population of the white blood cells of the patient, and therefore, and also the another indicator of immunity. Okay, so that is the comparative study. And in another study now, so basically this study I want to show you why many of the studies actually we reviewed earlier on actually selected those acupoints. In another study on the white blood cells of chemotherapy patients, they compare now 2 groups. Indirect moxibustion of GV14. Okay, GV14 already mentioned is just behind your neck. Bladder 17, okay, which is between the heart and the liver backshoe point, and BL20, which is a spleen point, the backshoe spleen point. And the second group was consumption of ginseng flower TCM medicine. Ginseng, you know, ginseng is supposed to be very good in terms of raising the, it's a very powerful tonic in raising the qi of the of patients. Okay, so compare the 2 groups. Okay, in terms of white blood cells effectiveness. So the cure rate 84%, effectiveness was 66.4 after 10 days of moxibustion, these 3 points alone. And the group 2, the cure rate 35.2, effectiveness was 33.3 of consuming ginseng flower with TCM medication. So what does this comparison actually tell us? Basically, moxibustion is more effective, faster in achieving the results as compared to the consumption of ginseng. Okay, in terms of raising white blood cells of chemotherapy. Okay, it is able to raise it quickly. Okay, it is able to overcome fatigue and also prevent side effect as well, according to the study. Now let's look at another study which is also commonly used by many practitioners in the hospitals, using moxibustion for treating cancer-related fatigue, CRF. Okay, so CRF, what is CRF? It's cancer-related fatigue. It's for patients who are currently undergoing cancer treatment in the hospital, or who have already undergone the cancer treatment. They remain very, very tired. And their tiredness is not the same as the tiredness experienced by ordinary people. For many of us, if we feel our body is being tired, a good sleep, okay, a good therapy, okay, a good spa will relieve us from the fatigue, and the fatigue should actually go away. The tiredness would disappear. But for the people for the patient who suffer from CRF, this CRF continue even though you practice those. You go for a massage, you go for a spa, you go for a therapy, the fatigue always there. And this is called cancer-related fatigue. Okay, so again, mainstream medicine, there is no good method of overcoming CRF. And moxibustion is often used. Apart from it, yoga is also being studied as a good form of relieving patients' CRF. So they recruited 96 patients and divided them into 3 groups. Okay, the first group, they treated them with a moxibustion. They selected these points, okay, which I already looked at earlier on. Okay, for 30 minutes, 2 times a week, for 8 weeks. The second group, they use sham moxibustion, not real moxibustion. Okay, in other words, and of course, they treat the non-acupoints with heat. In other words, they want to give the patient the false impression that this is also moxibustion. But the therapists do not apply them on the acupuncture point. Somehow just treat some part of the body. Okay, this is called sham moxibustion. And of course, the last group is the usual care group. The normal, traditional hospital therapy group. And again, we look at the results of the study. This is a brief fatigue inventory. This is a survey. A survey actually completed most likely to be by the patient themselves. Okay, so all the baseline, meaning that when they started the experiment, all the 3 groups have the same BFI, the same fatigue scale. In other words, all the patients were about the same fatigue level when they started. And what happened was that the solid line, you can see that the solid line. So after 5 weeks of treatment, after 9 weeks of treatment, and after 13 weeks of treatment over here, okay, the treatment only lasted for 9 weeks. For the moxibustion group, okay, it declined after 5 weeks, after 9 weeks, and continued to decline to week number 13, although the moxibustion treatment has stopped in week 9, but the patients continue to actually experience a good effect. For the sham group here, okay, which is not real moxibustion, somehow the patient also actually experience, they also feel that their fatigue level has come down, okay, during the period of forced treatment. But once the sham moxibustion has been removed, the patient now do not feel the real effect. And of course, for the usual care group, the fluctuation is very normal. In other words, the fatigue level, more or less, in other words, the usual hospital treatment do not help the patient at all. Okay, and this is the score of this experiment here. Okay, so the fatigue score in the MX group significantly decreased from the baseline to week 9 and even week 13, as I mentioned. Okay, but for the sham moxibustion group, it's only sustained to week number 9. Although all the three groups experienced a significant improvement in the BMI score at the week 9, the MX group showed the greatest improvement that lasted for the post-interventional period. And of course, if you can see that, I mean, in fact, for the normal group, there was a slight drop from the starting point. For the sham group, there was a significant drop equivalent to the moxibustion group, but that did not sustain once they stopped the treatment. Okay, interesting result. And changes in terms of the functional assessment of cancer therapy. In other words, the ability of the body to recover, now you can see from here, was used to assess a CRF as a secondary outcome. Okay, so it is used to assess fatigue characteristic and the related function. Okay, and in this particular case, you see that for the moxibustion group, which is the solid line, the functional score of the patient continued to improve until during when the therapy has actually stopped. Okay, it dropped slightly, but still at a very high level here. Well, the sham group here increased somehow, sustained until when the treatment stopped, and then dropped quite rapidly as compared to the other group. And then the normal hospital therapy group, the improvement is actually not very significant. Okay, so that is how this particular moxibustion study tells us. Yeah, this one is a detailed score actually showing the difference between the MX, that means the moxibustion group, and the sham. This is moxibustion compared with the normal hospital group, and then moxibustion compared with the sham moxibustion. And the comparison are over here. I think I do not need to go through them. So basically, this is just a summary of what I said earlier on. There was a significant improvement in terms of the fatigue score and the functional score, okay, of the moxibustion group. And that, in fact, the fatigue score continued to drop for the moxibustion group, continue to drop after they have stopped the treatment, whereas the other group did not sustain. So the conclusion from the study was that actually both the groups here actually alleviated the CRS symptom during the treatment period. Okay, although the improvement was greater in the MX group. Okay. Yeah, so as to why the SMX group, the sham moxibustion group, actually show improvement, that could be because of a psychological effects, you know, from the patient. They thought themselves. So the psychological improvement somehow give the patients, okay, the feeling that the symptoms had actually gone down, and in fact they felt better in that way. Okay, so in fact psychological treatment is also important. Okay, in some of the study on cancer related fatigue, they use counseling. They use counseling session to help the patient to actually calm down, to counsel them, so that you know, they think less about the fatigue, but think more on certain beneficial effects. And the result also has been studied in many clinical settings before. Okay, we look at this study briefly. No, I don't have. I mean, this is another one which is actually based in English. I think this study, I can send it to you if you want to. Other studies of moxibustion and their main findings. Yes, effect of moxibustion in this particular case here increases the white blood cell count. I think we have already seen this in one of the study earlier on. Okay, and of course here talk about the defensive yang energy related to the WBC. Okay, well, the defensive chi originate from the lower energizer. I'm not sure whether you are familiar with these terms or not. Defensive yang and defensive chi. Okay, these are basically some terminologies to describe the different types of chi or different type of energy in the body. Generally classify them as actually yang and yin. Okay, but then still there's one kind is called defensive. Defensive means defends the body against illnesses. Okay, so this defensive chi normally is actually in the lower energizer, typically in the kidney, and usually this is what we said mentioned about as a congenital constitution. When a person is very high in terms of congenitive constitution, the defensive chi is generally high. Okay, so after 1 day after application of moxibustion on CV6, CV4, which is below the abdomen, okay, and ST36, approximately 80% of patients show varying degree of increase of WBC. Okay, so the point I want you to take away is, you know, a cancer patient of yours come to tell you she has very low white blood cells. Okay, so what can you do? Okay, I will encourage you to actually use the Ontsu to apply intensely on the belly button and below, which is these 2 points here. Okay, this is CV4, 4 fingers below the navel, and CV6 is 2 fingers below the navel, and ST6 is the one on the leg, just below the knee. Yeah, so this is how you can actually make use of these studies in your treatment with your patients. Of course, quite shy as well. Okay, some of you are familiar with this. Okay, in one study, they study quasha here, therapy to increase. This is actually basically use a panel to actually the quasha to actually scrub on the back. Okay, scrub on the back so that you can see all the you know, all the Chinese call sha. Sha is something like sand. All the sandy material appear on the skin. Okay, the application of quasha therapy increases granulocyte. Granulocyte is one particular kind of white blood cells. Okay, typically important in terms of immunity for the patient. So 87% of them show an increased granulocyte count by the 2nd day of scraping the governor vessel and the bladder meridian, with a maximum increase of 270%. Wow, so you can see that some patient, the immunity, which is actually counted in terms by the granulocyte counts, okay, increase so tremendously. So when our Mitsui Ontsu key is used in this manner, it is also sometimes used as a quasha therapy. You use it to apply. Normally, I don't use it on the governor vessel. I use it on the bladder meridian. You therapy the bladder meridian on both sides until you achieve the same effect as the quasha therapy. In other words, you can see a lot of plenty, the whole section become pinkish in color, and sometimes it show up the sandy stuff as well. So when you do that, you are actually helping the patient to improve the granulocyte in her body. Okay, this is based on another study which can be useful to us. Now, lastly, before I leave this section, I just want to actually show you this diagram about the circulation of qi in the body. This is how the traditional Chinese medicine view the qi being circulated in the body. I mentioned about the lower abdomen, the lower, generally the traditional Chinese medicine divide the body into three sections: the upper section, the middle section, and then the lower section. They typically call it the upper jiao, middle jiao, and actually the lower jiao. The upper jiao is these two. Okay, the upper section. The lung and the heart is considered to be the upper. So in other words, when we do the therapy on the back, the upper thoracic area, typically from T1 all the way to around T5, T6, this area is known as the upper jiao. Below that section houses the liver, the spleen, the stomach, the gallbladder. This is called the middle jiao, or the middle section. And then at the bottom down there, the lower jiao, of course, we have the kidney plus the bladder. But the kidney is the most important in terms of the qi flow. Okay, for the inheritance, when a child is born healthy, the inheritance from the mother, according to traditional Chinese medicine, is stored inside the kidney essence or the kidney energy. Okay, so for a child, and that is called the congenital constitution. Okay, come with the child when he or she is born. Okay, some born with a plentiful or very rich kidney essence, but some not so well because the mother during the pregnancy months perhaps were not so healthy. She was hectic, and in that case, when she was born, the kidney essence was very, very low. But having a low kidney essence doesn't mean that the person will be unhealthy for life. We can still make up the shortfall for the congenital constitution by the acquired constitution. And the acquired constitution typically is achieved through the spleen and the stomach, okay, which is in the middle here. Okay, so this is how traditional Chinese medicine make use of the congenital constitution and the acquired constitution here. So in terms of qi flow, this should be the correct qi, the direction of the qi should be in this direction. The lung qi should descend and nourish the whole body. The lung qi should actually descend and actually nourish the whole body. The heart, of course, actually it has the gallbladder qi in this case here. The stomach and the gallbladder qi will descend. Okay, it descends. So if the stomach qi go up, that means something wrong with the stomach already. So often we see patients with the stomach qi reversing the direction. Obviously, the stomach is not well. We need to actually therapy the stomach to help the qi to descend. Likewise, a spleen cannot be actually descending. The spleen qi must go up and nourish the body, go up. So the flow of the energy is important. The heart qi, okay, in this particular, you descend again, nourish the whole body. Well, the kidney essence, the kidney water, kidney essence will rise, okay, and actually again supply to the whole body here. Okay, so this is how the body's qi direction actually move. Spleen, liver also go up. Okay, gallbladder come down together with the stomach. Okay, so this is the diagram for the qi in the body. You can actually make use of when you actually see your patients. Okay, so that's all for this particular section here on the Mokse Bhashan. And then finally, I want to move on to the last section, talking about now, after understanding hypothermia, after understanding Mokse Bhashan, we now move on to the treatment of cancer. And how can we make use of these two information now to help us move forward? Before I do that, yes.
Do they have
any question?
time? Yeah. Is it a good time now?
Sorry?
Good time for question now?
Do you have questions related to what I have just presented?
I just would like to ask if someone has a question. Okay, so yeah. You can continue.
I continue, okay. Let me get the other PowerPoint to be out first so that I can okay, this is my last PowerPoint for today's session. I call it Onetsu therapy for cancer. And wait. I want to again, because Onetsu therapy typically originated from the transformation of Mokse Bhashan. Is based on the principle of Mokse Bhashan, which is part of traditional Chinese medicine. So I want to go back to traditional Chinese medicine. How do they view cancer? Okay, according to the historical treatment, study of cancer in China, actually, traditional Chinese medicine actually has been able to find proof that the Chinese word for cancer was discovered even on a bone inscription that was discovered in one part of China 3,500 years ago. Okay, and it is this word here. And through the analysis of the word, they understand that actually 3,500 years ago, they already had to deal with some form of tumor, like what we are facing today. And if we look into the history of TCM treatment of tumors in China or using TCM, a lot of studies actually has been used to describe the symptoms, okay, the prognosis, the differential diagnosis, meaning that what is the diagnosis? Traditional Chinese medicine do not classify, for example, liver cancer as one type. Okay, they would classify what actually causes this person to have liver cancer. May generally group them into 3 or 4 different broad category reasons, and then once they identify, then once they match the symptoms to the particular category, they will be able to use the strategies for that particular categories to bring about the healing of the body. Okay, so this is how traditional Chinese medicine works. And in fact, in this particular document here, okay, this is a yellow emperor's inner canon. I think very famous. I think you know this probably if you study Chinese medicine. This is translation. With discomfort, with improper diet, with cold temperature from time to time, pathogens prevail. Okay, pathogen. In Chinese medicine, pathogen can be actually internal, can be external. Okay, prevail and accumulation has left in the body. So basically, what is saying here is that the Chinese, ancestors believe that cancer in this case here is an internal cause. In other words, is problem inside the body. Something not right inside the body. Could be something actually accumulated in the body. Okay, so this is based on this 2,200 years old document. And another document which is also 2,000 years old, you talk about ulcer, aggressive form of a tumor with ulcer. You say the ulcer is sore, is swollen, all because of the cumulative toxicity of the 5 viscera and 6 bowel. Okay, not always related to the wrong way congestion, not always related to blood circulation. This one is mostly blood circulation. Okay, what it says is that it is due to the accumulation of some form of toxicity in the body. Okay, in fact, in this particular document, it associates the locations with the location of, the tumor location with the source of the toxins. Okay, so if the source of the toxins, for example, exhibited is in the throat and tongue, meaning that the tumor, the aggressive tumor, has appeared in the throat or in the tongue, the toxin is actually in the heart. If the tumor is on the skin or in the scalp, the hair, the toxins is actually accumulated in the lungs. Likewise, if it is a muscle tumor, okay, most likely the toxin is accumulated in the spleen. Bone marrow, kidney. Okay, so this is how the ancient actually classified the, associate the location of the tumor with the sources of the toxins. And therefore, they exercise the methods to actually get rid of the toxins and therefore heal the patients. How successful it is, I do not have the data to show this, but this is described in this literature, which was written 2,000 years ago. Earlier on, I talked about the traditional Chinese medicine classified the body into 3 sections. The upper jiao, which is the upper warmer, heart and the lung. And the middle, okay, the spleen, stomach, liver, gallbladder. And the lower, the kidney, bladder, large and small intestine. So generally, when we treat the tumor, using TCM methodology, we want to know whether the problem is over here, here, or over here. And this is actually one of the, in one of the papers, it talks about how TCM can be used in terms of treating tumor, okay, various level and various purposes. So let me just go through briefly some of them. Okay. If it is precancerous, so this is precancerous, this is early stage cancer, this is middle advanced age, and this is advanced cancer patient not suitable for chemo or radio anymore. What can we do with TCM? Okay. Of course, for us, if we can implement over here, it will be excellent for us. Precancerous lesions. okay, before cancer come into the body. The therapeutic principle is to strengthen the body, okay, to create more resistance and to eliminate the pathogenic factors that has been accumulated in the body. Okay, and therefore the treatment of using traditional Chinese medicine here is to prevent the tumor occurrence in the body. Okay, so this is a precancerous lesion. In other words, before the cancer is formed. If someone actually has been detected with early stage, for example, first stage tumor or cancer, again, okay, the principle behind it, the therapeutic principle here is to strengthen the body resistance. Okay, very important. Don't go and target the cancer. Okay, first principle is to strengthen the body first. Okay, improve the spleen in terms, improve the stomach function, in terms of the kidney also, in terms of immunity of the body. So depending on where is the first stage or the early stage cancer, go and strengthen the body. Okay, so the treatment purpose of this strategy is really to prevent and treat the post-operative complication. Okay, I mean, in many cases, which in this case here, sometimes after the first, I mean, for the patients, they have already undergo the surgery. For example, let's say a first stage breast cancer. Okay, remove one side or part of the breast already. So the surgery itself is actually damaging to the body. So therefore, the purpose of that is to strengthen the body resistance and of course, to eliminate the pathogenic factors as well. Okay, and of course, okay, so this is the purpose of early stage. When it is coming to the middle and advanced stage of cancer patient now, okay, for example, doing repeated chemotherapy, the purpose is still to strengthen the body resistance. You can see from here, okay, and you want to reduce the adverse effect of chemotherapy drugs. Okay, strengthen the body resistance and eliminate again the pathogenic factors. Okay, and of course, during the maintenance treatment, and of course, you can see that this is also quite commonly used. Okay, to prevent the disease from worsening. And basically, if it is actually a cancer with aggressive cancer, is to slow it down, to extend life. Okay, so that the survival time for the patient is lengthened. Last is really to look at those advanced patients that have been given up by the hospitals. The oncologist said, okay, we don't have any more treatment. We have exhausted the treatment and therefore they have nothing left. You can go back. So during this period, if you encounter the patients in this particular period here, what can you do if you are practicing traditional Chinese medicine? So at this stage here, of course, your objective must be very clear. Your treatment principle must be clear and your treatment purpose must be clear. Okay, you must be more realistic. Okay, so you have to tell the patient the purpose of the treatment here is to help you to strengthen your resistance. Okay, and to remove as much pathogenic factors as possible, such as the chemotherapy side effects. Okay, the chemo drug that accumulated in the body. Okay, so during this stage here, the purpose is to treat, is to prevent the tumor development further and further and further. If we can arrest it, we can stop it or slow it down, it is very good for the patient. Okay, and of course, in this stage here, a lot of time is actually in terms of relieving the symptoms. Okay, the pain, the vomiting, the nausea, okay, the headache, the painful effects on the body, and so on and so forth. If we can actually help the patients to get less of this symptom, in this case, we can help the patient to improve the quality of life. And hopefully through that, we can actually extend the overall survival time of the patient. Maybe allow the patient to live another couple of months or even years. Okay, so this is a big, I mean, a big picture of how TCM can be used in the cancer treatment. And to a certain extent, I think for us practicing Onetsu therapy, I think is also can be used as a guide for us as well. So we need to be clear when we treat a patient, at which stage are we treating a patient, and then we have to set our principles, set our treatment purpose. Then in that case, you also not become frustrated. Okay. Now, a little bit more from the TCM perspective on the treatment of cancer. And here I mentioned that all cancer patients are yang qi deficient. I mentioned it earlier this morning. Okay. Some of you are familiar with yang qi. Some of you are not familiar. Qi, of course, is energy. Okay. Or life force. And let me just quickly go through this yang concept. Yin and yang concept in case you are not familiar. For those who are familiar, just treat it as a revise. So what is this yin-yang theory now? So yin-yang theory is a concept of dualism. In other words, there are only two things, yin and yang. Just like, you know, in the computer world, is 0 and 1, dualism. So all things have two facets. Everything have a yin aspect and a yang aspect. Nothing is purely yin or nothing is purely yang. Okay, you can have yang in yin and you can yin in yang. The two qualities oppose each other, while at the same time, they also complement one another. Okay, so the yin and the yang must necessarily contain the possibility of opposition and change. Okay, the separation, the interaction, and the merging, the yin and yang merge together. Okay, they create in one another, they control one another. In other words, they interact very closely with one another. Okay, so this is typically the symbol of the yin and yang. So yin, the black color is yin, the white color is yang. So typically you can actually think of yin as passive. Someone very active is very yang. The body feeling cold is yin. Anything that is hot will be yang. Death, of course, is yin. Life is yang. Ladies typically are more yin and men supposed to be yang. Daytime is yang. Nighttime is yin. Winter time will be yin. Summertime will be yang. The sun is yang. The moon is. So in other words, it's just this dualism is actually is observed in the universe. Okay. So what is this yin-yang theory? Actually started probably 5,000 years ago. And some said it is related to the symbol is missing here. It's actually the yin-yang symbol. And it is related, if you want to actually see closely, it is related to the different seasons of the year. The summer solstice, the autumn.
Yes. We cannot see now what you are showing us.
Can you see now?
No, the video we don't see now.
You don't see, You don't see, Okay. Oh, sorry. I have, because it is jumping from the next screen. Let me just call up the screen. You should be able to see now.
We see the PowerPoint now. The yin yang
Yes.
theory.
Yeah, the yin yang theory. So
Yeah.
I was just saying the yin yang is a concept of dualism. Okay, there's a yin aspect and there's a yang aspect. So basically, yin is actually associated, it's a dark color in this symbol. The white color is yang. Yang is associated with active, hot, lively, summer, man, daytime, odd numbers, the sun, the fire. All these are the yang qualities. The yin qualities are passive, cold, deaf, wintertime, ladies, nighttime, even numbers, the moon, the water, all these are the yin in nature. Okay. And when does this theory started? Actually started 5,000 years ago in China. And it is associated with the universe. So yin yang is not only related to our health, but it is related to our universe. So our world, in fact, is very similar to the body. That's why sometimes we said the body is a small universe. Our body functions like the small universe. Okay, that's what it meant. So different time of the year, the winter solstice, the summer solstice, all these are related to they can see that's how the graph is actually been formed over here. Okay, and this is another graph again showing the different hours of the day. I think you should be familiar with this symbol. Anyone? What flag is this? Do you know? Happen to know?
Korea.
Very good. This is the flag of Korea. The flag of Korea is actually based on yin-yang symbol. Okay. And of course, the two colors, they have changed the color, but this is basically this is yin, this is yang. And this symbol here, a longer stroke and a smaller stroke here, this is called yin, this is called yang. Okay, this is double yin. Double yin. Double yin means almost, utmost, very, very yin. Yang within a yang, okay, within a yin. Okay, you can see that. And then yin within a yang. And then this one is most yang. So different degree of, so in other words, different combination. Okay, so this is one symbol where it is used commonly. And those of you who actually understand about, I don't know, a particular method known as Pakwa, okay, basically it's a way of actually analyzing. This is related to, for example, feng shui. You know feng shui?
Yes.
Yeah, you look at the environment. Okay, you look at the environment. Basically, they divided into 8 different types, and from there they can calculate. They can tell you which one, what you should do, for example. Okay, and these are the 8 different combinations. Okay, this is how the yin-yang symbol. And of course, people have been using this in China, for example. Okay, you can see that. Okay, practice your qigong, practice all your movement inside this. Okay, and many places in China, they have this yin-yang symbol. Okay, but basically, yin-yang are opposites. They are interdependent. They are interchangeable. Okay, they can transform from one into another. And part of yin is in the yang, and part of the yang is in the yin. Okay, I think just very briefly, I just go through. Okay, and typically this is what many people believe in imbalance. When I say imbalance, means it is a lot of yang and, for example, a little bit yin, or too much yang, too little yin, or too little the other way also possible. Okay, and the use of yin yang here, I think most important for us is to understand it in terms of practicing traditional Chinese medicine, in acupuncture, in herbal remedies, in exercises, in the diet, and of course, in the practice of Tai Chi as well. Now, for good health, all of us know you must have a yin-yang balance. But what is yin-yang balance? Okay, typically this is what people believe. This is imbalance and this is balance. Okay, but I want to bring another concept, another aspect of yin-yang balance here. Okay, so this is what many practitioners, especially the Western practitioner, understand in terms of yin and yang. So you will see that 50% here and 50% here. This is yin-yang balance. But this prominent traditional Chinese medicine practitioner who has actually cured tens of thousands of patients, okay, with his method, says yin-yang balance is the balance of yin and yang obtained under the dominance of yang. It is never a 50-50 division. In other words, the yang energy, the yang energy part must be the dominating factor. Once it is dominated, then you try to achieve the yin-yang balance. The yang must be the commanding one. Okay? Human yang energy is the foundation of life. And yang is in the commanding position and is a dominant force. All the yin things are under the command of the yang. And they are not half-baked equal, and yin-yang are balanced. This yin-yang balance differs to the balance of yin and yang under the dominance of yang qi. Very important. Okay, when we treat our cancer patients, remember this one here. According to him, from the tens of thousands of patients I treated, up to 90% or more of them are yang qi deficient, yang energy deficient. There are hardly any yin qi deficient patients around. So most of them in today's society, okay, we make use of a lot of artificial things, antibiotics, air cons, okay, all these actually contribute towards the reduction of yang qi in the body. So how do we check whether you have yin-yang balance or not? Of course, those of you actually who practice pendulum, okay, who practice pendulum, you can make use of your pendulum to check whether are you in this category or are you in this category, okay, or are you in this category of supposed to be yin-yang balance. So this is one of the one possibility you can actually check yourself, okay. Those of you who are interested perhaps in the use of the pendulum, maybe some other time we can actually talk about how to use a pendulum to actually determine yin-yang balance. And the other important thing I want all of us to understand is that different parts of the body are classified into yin and yang part. Okay, important thing is the front part here is considered as yin, behind is considered as yang. The upper section from the belly button upwards is considered as yang, the lower part is yin. Okay, and the inner section, let's say for example, when you put out your arms like this, the inner section, this section here is yin, this section here is yang. Okay, blood, lymph, and all other fluid are considered as yin. they are more yin in nature, whereas your qi is yang in nature. So all our organs are classified into yin organ and yang organs. Yin organs are supposed to be deeper, yang organs are supposed to be near the surface. Okay, and this is how they classify. Okay, those of you who have already studied traditional Chinese medicine, for example, learn about the 12 meridians. The organ, the meridian come in the form of pair. Spleen and stomach is one pair. Liver, gallbladder is a pair. And for each of the pair, there is a yin and a yang. Okay, and this is typically known as the chang organ or yin organs. And the yang organs are the fu organs. Okay, so this is how, I don't know whether you are familiar with this, but never mind, these are the pair. Earlier on, we keep mentioning about spleen, stomach, which is very important for the healing cancer patient, because these form the, the acquired constitution. And according to traditional Chinese medicine, each pair of this is associated with an emotion. Okay, an emotion. So an understanding of this, of the problem, for example, okay, if you see a patient, okay, with a stomach cancer, most likely the patient is experiencing overthinking. In other words, continue to think and think and think. So if you understand this particular relationship, you can advise the patient to actually to be more open, to do not think so deeply about situation, about condition they are facing. Because if you over indulge in this emotion, it will further damage the organs further. Likewise, for liver cancer patient, it is always associated with anger. The anger will make the liver condition worse. Lungs and large intestine is associated with grief. Somebody passed on, and actually the person is actually grieving over the loss, often leads to lung cancer. And in order to be relieved from the lung, the person must stop to actually relieve of the grief feeling. And if you see a patient who is very, very fearful, everything very timid, dare not try this, dare not try that, most likely the person has a kidney weakness. Okay? And last but not least, joy. Overjoy can cause a heart attack. Okay, someone strike a battery, someone strike a lottery, and the next day they pass on. That due to the heart attack. Joy can be very damaging. Okay, so that's how emotion is classified. And these organs, by the way, I just want to mention that they are all related. The yin and the yang are actually continue in a cycle like this. I think all of you are familiar with. If not, you can take away with this this chart here, okay, which is of course the organ clock. Okay, start from for example at 11 p.m. midnight, almost to midnight. This is a period we always say. Start from here. This is the yang organ. The repair time for the gallbladder is 11 to 1 a.m. Okay, and from 1 a.m. to 2 and 3 a.m. that is a liver, and then continue in this manner here. So if you want to heal the body, okay, let's say for example, someone is actually suffering from a kidney cancer, for example. So you know the kidney is related to the bladder, but kidney healing time is from 5 p.m. to 7 p.m. This is the best time to treat the kidney. Okay, if you want to perform treatment of the kidney, you want to heal the kidney condition, allow this time to actually do an onetsu session, at least one session here during this period. Of course, any other time also useful, but these periods will be very, very useful for the patient because the body reserves this period for the repair of the kidney. All the resources are reserved for the repairing the kidney during this period. And during this period, if we put in more resources to the body, then of course the repair will be in greater steps. Okay, better for the cancer patient. Okay, so that is this section here. I want to bring you back to the earlier on. To my slides earlier on. Now, we were talking about this slide here. We said all cancer patients are yang qi deficient. And therefore, like the big picture chart I show you, we want to improve the functional ability of the person. And in this case here, we want to restore the yang qi. Is the most important task if one wants to defeat cancer. Okay, it's already deficient. So therefore, we must help the patient to restore the yang qi. So the first step here is to stop the body's yang qi from depleting further. Okay, in other words, this is to preserve life, especially for those who have been heavily damaged by the drugs or the radiations. Okay, the yang qi is depleting, and we must quickly help to stop the depletion. We also need to build the body's yang qi. To do that, we need to enhance and repair the defective stomach qi. Okay, come back to the stomach and the spleen function again. And this is very important. Afterward, I shall show you one of the case of a stomach cancer patient. If you cannot stop the stomach qi from depleting further, then the days of survival will be numbered. Okay, so the stomach qi must be repaired because it is through here that you are able to build up the depleting qi slowly. Of course, in terms of nutrition, we are saying that the stomach will be able to digest and of course absorb by the small intestine so that the body can help to the body can be built up to repair again. Okay, so this is what it is. So we can arrest the yang qi decline and boost it by using traditional Chinese medicine formulated concoction. Okay, there are various types to match the syndrome differentiation. Okay, first step is to stop the qi from leaking, from depleting. The second part is slowly to actually build it up. We make use of course, Moxie version or our onetsu device, but there are concoctions. Okay, some of you make use of supplements. So basically, they are similar to TCM's concoction if you know how to use them. Okay, so the combined use of both will be very useful in terms of arresting and rebuilding the yang qi in the body. So once the yang energy has been built to a certain high level, we can start tackling the tumor. This is step 3 in the cancer treatment process. So I just want to repeat that again. In summary, we say, in terms of treating the cancer, traditional medicines do it in this way. The first step is to prevent the yang qi from declining further. Stop the leakage. Where is the leakage? Quickly stop the leakage there. Second point, after you have done so, the qi, the yang qi is no longer, you know, no longer, reducing every day. But now you need to, because it is still very low, you need to build it up. You can build it up through the use of prescription or through the use of moxibustion, or both. And then thirdly, once you have done it to a certain level, the third level will be now to tackle the yang energy. Tackle the tumor, sorry. So let us look at how traditional Chinese medicine is used in the cancer treatment now. Supporting role, I think we have seen that. We have also looked at therapeutic function of TCM in advanced cancer patient. We have briefly discussed that. How support the post-operative cancer patient, yes. And of course, prevention of cancer in the precancerous situation, we have briefly discussed that as well. Now, we have also talked about this, I think, in greater detail earlier on. We said TCM can improve the efficacy of radiotherapy and chemotherapy. Typically talk about how hyperthermia and how moxibustion can do it. It does so by actually tonifying the qi, by producing more blood, by strengthening the spleen and the stomach function so that absorption and digestion are good, by nourishing the liver and the kidney, and of course, remove inflammation, okay, and toxic materials from the body. So that is how it can actually improve radiotherapy. Some of these, like for example, the inflammation caused by the radiotherapy or the heat from the radiotherapy. And then TCM combined with chemotherapy also shown a favorable effect in improving the chemotherapy with less adverse reaction. Okay, we have talked about that when we look at chemotherapy, when we look at hyperthermia. Okay, with those in background now, let us apply to Aunetsu now. How can we put a feasible set of protocol together in the treatment of cancer?
Man,
Yes.
man, is it okay for now?
Yes.
15 minutes?
15 minutes break?
Yes, it's a
okay.
Yes. Okay?
All right. Okay. We'll stop here for a while.
Okay. יש פה קערות מבלגות. בוא תקראו, נעשה כמה דקות, טיפי. לפני. כן. לא, אבל בדיוק מדהים את הכתיב. אני צריכה לעשות.